Okay, so let's talk about intracranial pressure for just a second. And I know that I have the normals and things listed on your slides. 0 to 15 is your normal intracranial pressure. The thing here is that you need to understand that you have something going on inside your head, which is encapsulated by this bone in the skull. So they have the swelling of tissues going on inside there, and it's swelling and swelling and swelling, but there's nowhere for the bone to move and expand. And so what we know is that we have different volume components in the brain. You have the cerebral spinal fluid that components about 10% of all the components in the intracranial area. The intravascular, which is your blood, is about 10%, and then the brain tissue comprises about 80%. So we know that slight changes in the volume of any of these compartments or these components is compensated by a change in another compartment. For example, if we had too much cerebral spinal fluid, generally speaking, one of the other compartments, either the most probably the blood volume would compensate by decreasing the amount of blood in the brain, so that if this one was a slightly high, the other one would be slightly low, and so that would cause a balance. The problem that is when we have elevations in the intracranial pressure, it causes that brain to swell, and there's nowhere for it to go but out. And so what we look at is we see that it herniates, which we're going to get to. So the cerebral spinal fluid and the intravascular blood, I said, are the best ones that compensate for changes. It's really hard to compensate in the brain tissue because you're not going to lose brain tissue per se. Some causes of intracranial pressure are on the next slide. Those are more like anything, if you can think of anything inside your brain that would grow or cause pressure or bleeding. So just cerebral edema, so like hyponatremia, causing cerebral edema, excessive cerebral spinal fluid production, a tumor, pituitary, hypothalamus, an eye tumor, or anything inside the brain, a hemorrhage, a stroke, an aneurysm that ruptures. Any of these things displace the brain and cause pressure and swelling, and can be a sign or can be a cause of intracranial pressure. The thing is that when the compensatory mechanisms fail, meaning that one compartment can't adjust or compensate for the other, that's when we start to see the signs and symptoms. Things that we might expect, or the earliest and most reliable signs of increased intracranial pressure is a decrease in the level of consciousness of someone that has a change from like very alert and like I'm talking to you walk in there and they're confused and lethargic and maybe slipping slowly off into stupor and coma. So that's kind of one of the earliest signs or most reliable things is a decrease or of the level of consciousness. What is a major complication of increased intracranial pressure? Like I said, the more pressure you have in the brain, it has nowhere to go. It's not going to bust the skull to come out and get bigger. It is going to go down. It's going to herniate, and that is going to be one of the major complications that you're going to see with increased intracranial pressure.